Hello again everyone, Dr. Dan Bockmann here. Today we're going to talk about pinched nerves. So oftentimes in practice I'll have a patient who's really concerned. They come in with pain and they're very concerned that it might be a pinched nerve. And of course that's a layman's term, but any nerve compression or irritation or damage is really what they're talking about. And I think the reason people are so concerned about this is because either they've had a family member or a friend who's been told they had a pinched nerve and they had a long painful recovery, or maybe they needed surgery and they don't want that thing, which is understandable. Or it just sounds like it's a bad thing if a nerve's damaged as opposed to, say, a muscle. So a pinched nerve is a real thing. I'll say this too. Technically, all pain is nerve pain. Meaning, if I hit myself with a hammer and it hurts, it's because I damaged some little nerve endings in my arm. We have them everywhere. They're encasing us everywhere. And then those little nerve endings sent signal to my brain that told my brain to interpret it as pain. So all pain is nerve pain. There's no, well, is it muscular or is it nerve? All pain is nerve pain. So so a bruise, a broken bone, it's all the same. So there's nothing especially scary about nerve pain. Having said that, if you do have a pinched nerve or something compressing a nerve, whether it's a disc bulge or a bone spur in your back, or maybe it's your piriformis muscle's too tight in your hip and it's pinching your sciatic nerve that runs down your leg, all those things are an example of nerve pain or nerve injury. It's not automatically a scary thing either. So typically, here's what to look for to see if you have a pinched nerve. Typically, there are three nerve symptoms. There are pain, numbness, and weakness. Those are the three main ones. There are some others too, but those are the three main: pain, numbness, and weakness of a muscle. Because nerves carry all kinds of data. They carry pain data, sensory data, which would be numbness if you don't have enough, or tingling would be intermittent sensation. And weakness means the nerve, the data supplying the muscle that we're talking about, is unable to get through because of the pinch spot, like a garden hose being pinched, and no water can get through or no nerve signal can get to that muscle, and therefore the muscle feels weak because it can't be told what to do. It's not obeying you. Now, and oftentimes a pinched nerve will give you pain across a distance, continuous pain. So for example, all the nerves in our arm come from our neck. If there's a pinched nerve in this area here, it may give you radiating pain or numbness down, say, even to fingers. Doesn't have to be the entire root of the nerve. Maybe it just goes from here to here, or goes to mid forearm, or down the back of your leg to the knee, or past the knee, or even to the sole of the foot. So those are kind of the symptoms of a compressed nerve or a pinched nerve. Again, I'll urge you not to be overly concerned. Don't lay awake at night worrying that you're going to have a surgery just because you have those symptoms. In the huge majority of cases, the pinched nerves that we see in my office, they're very straightforward and easy fixes, and they don't come back, and they're as long as you do the maintenance work to keep that pinch from happening again. So anyway, I hope that's shed a little light on what a pinched nerve is. If it's been helpful, subscribe below. If you have a question of your own you'd like me to answer, leave that as a comment in the comment section below. I'd like to get back to you with a personal video answer as well. Thank you again. I'll see you guys next time inside.